Welcome to this explainer. Today, we're tackling something absolutely crucial. We're going to take California's notoriously confusing, jargon-heavy long-term care bureaucracy and translate it into a clear, actionable map. If you've been banging your head against the wall trying to figure out how to care for an aging parent without literally going bankrupt, well, you're in exactly the right place.
Okay, let's just dive right in. Picture this. It's 11 p.m. You're sitting at the kitchen table, running on fumes. You've got a browser open, desperately searching assisted living California cost, and that number staring back at you is, well, it's making you feel a little sick, right? You love your parent, but you also work, you've got your own kids, and let's be real, you haven't slept properly in a week. Somewhere in that blur of late-night search results, you probably stumbled across 3 words that sounded like a tiny bit of hope: assisted living waiver. Today, we're going to walk right through that door together.
So here's the roadmap for how we're breaking this all down. First, the kitchen table reality. Second, what exactly is the ALW? Third, who actually qualifies? Fourth, the costs and that dreaded wait list. Fifth, some other paths and support options. And finally, your concrete action plan.
All right, let's start with part 1, the kitchen table reality.
Before we get into the weeds, I really need you to hear this. You did not cause this. Your parent aging is not your failure. The fact that you can't personally provide 24/7 care, that's not a character flaw, okay? Asking for help is absolutely not giving up on your parent. When you apply for state programs, you're just using a system that was built for this exact moment. You're allowed to be tired. And you know what? You're allowed to feel a massive sense of relief when they're finally somewhere safe.
Moving right along to Section 2, what exactly is the ALW?
Let's just strip away all that complex government jargon from the California Department of Healthcare Services and get straight to the facts. The Assisted Living Waiver, or ALW as literally everyone calls it, is a Medi-Cal program. And just a quick reminder, Medi-Cal is basically California's version of Medicaid. Now, historically, Medi-Cal will pay for a nursing home, and sure, it'll pay for some care in your own home, but that crucial middle place, assisted living, where your mom or dad has their own room, gets help with bathing and meals, but isn't stuck in an institutional setting, that's traditionally been private pay only. The ALW steps in to bridge that gap. It is that critical, missing middle ground.
So you might be wondering, why does this even exist? Well, California actually went and got permission from the federal government to use Medicaid dollars in a totally non-standard way. The goal here is pretty straightforward. Redirect those funds to pay for assisted living instead of a nursing home, specifically for seniors who would otherwise end up in that nursing home. It's all about this philosophy of home and community-based services. Basically, keeping people out of institutions when they'd be so much happier and safer in a normal residential setting.
Which brings us to Section 3, who actually qualifies? Because this program is literally designed as a direct alternative to nursing homes, you have to clear 3 very specific hurdles. First up, your parent has to be eligible for full-scope Medi-Cal. We're talking full scope here, not emergency, not partial. Second, they need what's called a nursing facility level of care assessment. That means they need way more than just a little help getting dressed or a few pill reminders. They need serious, hands-on help with daily tasks like bathing, transferring out of bed, or managing severe cognitive needs like advanced dementia. And finally, number 3, they have to live in an ALW-enrolled setting. Keep this in mind because it's a big one. Not every gorgeous assisted living building in your zip code actually participates in this program.
So how do you actually get through those gates? Well, here's the trick. You don't apply directly to the state, and you don't apply to the facility either. You apply to a care coordination agency. These are specific organizations contracted by the state for your exact county, and they act as the absolute front door to this entire program. They're the ones who handle the clinical assessments and push through all that tedious paperwork.
Okay, on to Section 4, costs and the wait list.
I'm going to play the honest editor here for a second, mostly because those glossy facility brochures almost always skip right over this part. The ALW pays for the care. That includes the bathing, the medication management, the nursing services, and the coordination stuff. But, and this is a big but, what it absolutely does not pay for is room and board, meaning the rent and the food. Federal Medicaid rules generally just don't allow it. But don't panic, here's the built-in safety mechanism. California actually caps what the facility can charge for room and board, tying it directly to the Supplemental Security Income, or SSI, payment level. So usually how it works is, your parent's SSI check goes straight to the facility for room and board, and Medi-Cal swoops in to pay for the actual care.
Now, we've got to talk about the elephant in the room. What about the wait list? Let me be completely straight with you on this one. Demand for the ALW consistently, massively outruns the number of slots the state is actually authorized to fund. You apply, You get on the list, and you wait. And we're not talking days or weeks here. This wait can literally be many months. If your parent is being discharged from the hospital on Friday, I hate to say it, but the ALW is not your magic bullet for Monday morning. Because the ALW is definitely a long game, you have to build what we call a bridge. While you're sitting on that wait list, how do you keep your parents safe? Well, your bridge might look like a short rehabilitation stay covered by Medicare. Or maybe it's scraping together some funds for a private pay month or two. Actually, another great option is utilizing intensive in-home supportive services, or IHSS, with family helping out around the clock at home. The point is, you just need a solid plan to hold things together until your slot finally opens up.
Moving into Section 5, Other Paths and Support.
It's absolutely crucial to understand the whole map here so you can make decisions without panicking, especially if the ALW just isn't a good clinical fit, or if that waitlist outlasts your family's ability to bridge the gap. Look, California actually has a much wider safety net than most people realize. Programs like IHS can literally pay a caregiver, sometimes even a family member, to come into the home. There are daytime programs with nursing and social engagement, plus programs specifically built to help manage complex care at home. And yeah, sometimes a skilled nursing facility paid for by Medi-Cal is just the legitimate right choice if your parents' needs have simply outgrown what assisted living can handle. The ALW is an amazing tool, for sure, but it's definitely not the only tool in the toolbox.
All right, let's bring it home with Section 6, Your Action Plan.
Grab a pen because here is exactly how you're going to build your to-do list for this week. First, confirm if your parent has full-scope Medi-Cal. If they don't, start that application right now. Second, hop onto the Department of Healthcare Services website, find the care coordination agency for your specific county, and give them a call. Third, start pulling together all that annoying paperwork, recent hospital discharge summaries, medication lists, doctors' phone numbers. Fourth, search the state's registry for ALW-enrolled facilities in your area and start touring them so you know what you like. And fifth, sit down with your family and map out your 90-day bridge plan.
Now, when you're making these calls, whether it's to the county, an agency, or especially to some stretched-thin hospital social worker, you have got to cut right through the noise. Your magic phrase is exactly this: assisted living waiver. Please don't just ask for help with housing or say you need assisted living. Use the exact program name so they immediately know which track to put you on.
As we wrap up our map of the ALW, I want to leave you with this one thought. You are not behind. You are right on time. Seriously, you probably didn't even know this existed until tonight, and now you do. You've got the steps, you've got the terminology. Taking just one single step tomorrow, even just Googling your local care coordination agency, that is a massive victory.
So you now have the map to navigate the ALW today. But the system never stops evolving. Actually, there's a huge shift happening right now that touches literally every Medi-Cal family in California. So I'm going to leave you with this question to chew on. What the heck is CalAm, and how is it going to completely revolutionize the way your parent receives care under Medi-Cal? It's a massive puzzle, but we are going to decode the whole shebang in our next explainer. Until then, keep learning, keep pushing forward, and I'll catch you next time.